Cancer is one of the diseases that seniors fear the most, and not without reason. In the United States, more than 60% of cancer diagnoses occur in people over 65. But sadly, most cases are detected at a late stage. When treatment becomes more difficult, costs increase, and survival rates plummet. Why is this? Is it because older people's bodies are weaker? Is the disease progressing silently? Or is it because the patient and their family are complacent? In fact, many cases of cancer in older people are overlooked because they think it's normal aging symptoms. A 70-year-old may feel tired, have a persistent cough, or suddenly lose weight, but not go to the doctor because they think it's just a consequence of aging. And by the time the pain becomes obvious, the disease is already in the final stages. Today's video will analyze with you 5 important reasons why cancer in the elderly is often detected too late. Not only to better understand the nature of the disease, but also to give early warnings to yourself, your loved ones, or anyone who is entering the age of that atypical. Don't let subjectivity rob you of the opportunity for timely treatment. Let's listen, so that no one has to say the 2 words, if only. In tears. Reason 1. Vague symptoms, easily confused with old age diseases. One of the most common reasons why cancer in the elderly is often detected late is because the initial symptoms are very vague and easily confused with the natural aging process or chronic diseases common in the elderly. Think about it. An elderly person feels tired, has a poor appetite, has back pain, urinates frequently at night, or loses a few pounds. What is the first reaction of them and their loved ones? That's just how old they are. Probably because of a few days of insomnia. Back pain due to degenerative spine disease. Loss of appetite due to digestive disorders due to old age. This familiar and subjective explanation has caused many early warning signs of cancer to be overlooked, or treated as another benign disease for months, even years. Mild but dangerous symptoms. Let's take a specific example. Colorectal cancer can start with a change in bowel habits, constipation, irregular diarrhea, or bloody stools. But these symptoms are very similar to colitis, digestive disorders. Lung cancer can initially be just a mild dry cough, sometimes coughing up blood and phlegm, easily misdiagnosed as chronic bronchitis, COPD. Prostate cancer has symptoms of frequent urination at night, difficulty urinating, very similar to benign prostatic hyperplasia, a very common disease in older men. Early breast cancer may be painless, just a small lump that is difficult to detect, especially in postmenopausal women, when the breast tissue changes and becomes less sensitive. When these vague signs are ignored or treated in the wrong direction, the tumor continues to grow silently. By the time symptoms become obvious, such as persistent pain, unusual bleeding, rapid weight loss, a growing tumor, difficulty breathing, or bone pain, the disease is already in an advanced stage, even metastasizing. The trap of getting used to the abnormal. Another factor that causes cancer symptoms to be overlooked is that older people often get used to the inconveniences in their bodies. They have lived with back pain, difficulty sleeping, nocturia, loss of appetite, etc. for many years, so when cancer appears and worsens the situation, they do not recognize the obvious difference. They learn to endure, not out of courage, but because of lack of information and fear of disturbing their children and grandchildren. They accept pain, fatigue, as an inevitable part of aging. So how to distinguish? It is not easy to distinguish the symptoms of aging from the early signs of cancer. But there is a simple rule. If a symptom lasts for more than 2 weeks without a clear cause, no matter how small, go to the doctor. If there is something different than normal in the body, listen and check. In addition, annual screening is the most effective way to detect cancer early, even when there are no symptoms. Don't wait until the body cries for help to act. Older people are not always weak, but their bodies are very good at hiding the disease. The smallest signs, if ignored, can be the first step leading to late detection. Don't ignore the difference. Sometimes, a persistent cough can be the final warning. Reason 2. Subjective psychology, fear of treatment, reluctance to go to the doctor. In the elderly, one of the biggest barriers that causes cancer to be detected late is not in medicine, but in psychology. Specifically, it is subjectivity, fear, and avoidance when facing abnormal signs in the body. It's normal to get sick when you're old. Many elderly people, especially in the previous generation, have a very common way of thinking. I've lived this long. Getting sick is natural. Now that I've found out I have a serious illness, there's no point in treating it. Well, if I'm sick, I don't want my children and grandchildren to worry and waste money. Because of that thinking, when symptoms such as prolonged cough, dull abdominal pain, difficulty urinating, or unusual weight loss appear, they do not go to the doctor immediately, but silently endure, or find ways to self-treat with herbal medicine, functional foods, or simply leave it alone. Fear makes them silent. Many elderly people are not subjective because of negligence, but because of fear. They are afraid that if they go to the doctor, they will discover cancer. They are afraid of being hospitalized, afraid of chemotherapy, radiotherapy, afraid of surgery, afraid of losing the ability to live independently. Some people who have witnessed friends or relatives going through difficult cancer treatment have assumed in their minds, cancer is the end. Knowing that the disease is serious will only add to the suffering. It is better to not know, to have peace of mind. That fear makes them delay going to the doctor even though there are clear signs. And sometimes, they even hide the symptoms from their children and grandchildren so as to not cause trouble. Afraid to go to the hospital, afraid of being bothered, afraid of spending money. Some elderly people do not go to the doctor not because they do not want to, but because of many practical barriers. They are afraid of bothering their children and grandchildren to take them to the hospital. They have difficulty moving, especially if they do not have someone to support them. They worry about the cost of medical treatment, even though they have insurance. They are not used to the modern medical system, or are afraid of having to stay in the hospital for a long time. All of that makes them choose to stay silent, endure, and hope that everything will pass by itself. But illness does not wait for anyone. Cancer does not. This mentality needs to be changed from the family itself. If you have elderly parents or grandparents, take the initiative to ask about their health. Not just, is mom well? But, is mom eating well lately? Does dad have any pain anywhere? Is there anything strange about your urination these days? Are you more tired than usual? Sometimes, just a sincere enough question will help them open up and share what they have kept hidden for months. In addition, it is necessary to explain to the elderly that early detection is not to cause anxiety, but to increase the chance of a healthy life. Medicine has advanced significantly today. Many types of cancer, if detected at an early stage, can be cured or controlled very effectively without heavy intervention. Silence due to fear is sometimes more dangerous than the disease itself. We cannot change our age, but we can change our perspective on health. Do not let subjective psychology or fear cause the elderly to lose the opportunity to live many more healthy years, fully with their children and grandchildren. Reason 3. Not having regular screening. Missing the golden opportunity for early detection. Cancer screening is one of the most effective ways to detect the disease even before there are obvious symptoms. In the early stages, many types of cancer can be completely cured or controlled long-term with minimal cost and intervention. However, the sad reality is that most seniors do not maintain the habit of regular screening, even though they are the group with the highest risk. Why do seniors rarely get screened? There are many reasons why seniors do not get screened regularly for cancer. Lack of information. Many people do not know that they need to be screened. They are not reminded by their doctors or do not understand the benefits of this. No symptoms, so they think they are healthy. The common mentality is, I feel normal, no pain, so I probably don't need to get checked. But early stage cancer is the quietest. No pain, no fatigue, no obvious symptoms. Fear of the procedure. Some people are afraid of procedures such as endoscopy, mammography, biopsy, because they think it will be painful, troublesome, or time-consuming. Lack of transportation support. Elderly people often find it difficult to go to the hospital by themselves. If their children and grandchildren do not take them, they will delay and then forget. Cost. Although many screening programs in the U.S. are covered by insurance or are free, many seniors are still afraid of finding a disease and then spending money on treatment. What is screening and why is it important? Cancer screening is a regular health check to to detect early signs of cancer, even when you feel healthy. Common forms of screening for seniors include mammogram, early detection of breast cancer in women, usually starting at age 50 and up. Colonoscopy, detects polyps and colorectal cancer, recommended from age 45 to 50 and up, repeated every 5 to 10 years. PSA test, for men to screen for prostate cancer. Low-dose chest CT scan, for people with a history of smoking, to screen for lung cancer. Regular skin examination, helps detect skin cancers early, especially melanoma. These methods are often quick, minimally invasive, and can detect cancer at a very early stage, before causing any symptoms. Consequences of not screening. If screening is ignored, the disease will only be detected when there are obvious symptoms, such as pain, bleeding, rapid weight loss, large tumors, or serious complications. At this point, the cancer may have progressed to a late stage, making treatment difficult, expensive, and greatly affecting quality of life and longevity. Many people regret when they discover the disease. I wish I had an endoscopy sooner. I could have just had a small surgery, but now it has spread. If I had known, I would have had a mammogram last year. Change starts with an appointment. Just think about it. An annual screening, even if it only takes 1 to 2 hours, can save a lifetime. And if you have an older loved one, don't wait for them to ask. Be proactive in helping them schedule a checkup, explain it gently, and walk with them on their health journey. Screening isn't about being overly anxious. It's about loving yourself. As you age, every year is precious. Don't let cancer rob you of your chance at a healthy life, just because you see nothing wrong. Reason 4. Lack of knowledge and misunderstanding about cancer risks in old age. A silent but extremely important reason why cancer in the elderly is often detected late is lack of basic medical knowledge, along with many harmful misunderstandings about cancer and age. I'm old. Cancer probably won't come to me. Many elderly people believe that at this age, their bodies are hardened. If they didn't get cancer when they were young, then they won't have anything to worry about when they're old. They think cancer only happens to young people, people who work under stress, or those with a special history. But the reality is completely the opposite. Cancer is more common in older people, not because they are weaker, but because the natural aging process causes cells to be damaged and mutate over time. The immune system also gradually weakens, making it less able to detect and repair faulty cells. Many studies show that more than 60% of cancer cases are diagnosed in people over 65 years old. That is, the older you are, the greater the risk. But unfortunately, many people do not know this. Confusing chronic diseases and signs of cancer. Older people often live with diseases such as diabetes, high blood pressure, cardiovascular disease, arthritis. These diseases make them easily subjective with unusual symptoms. For example, prolonged cough, thought to be due to chronic lung disease. Dull abdominal pain, thought to be due to irritable bowel syndrome. Fatigue, loss of appetite, thought to be due to medication. Nocturia, difficulty urinating, thought to be due to age or benign prostatic hyperplasia. They do not think of the possibility of cancer, simply because no one has ever mentioned these connections to them. Lack of knowledge about early warning signs. In the elderly community, especially those who live independently, far from their children, or have little contact with medical media, knowledge about early signs of cancer is almost zero. They do not know. A painless lump can also be cancer. Unusual bleeding, even a little, is also worrying. Unexplained weight loss is a dangerous sign. Coughing up blood, changes in stool, hoarseness can all be indicators of cancer. When they do not know, they do not go to the doctor. When they do not go to the doctor, the disease continues to progress silently. Rumors and misunderstandings aggravate the problem. In addition to the lack of official information, many older people are also affected by rumors and false word of mouth. For example, cancer spreads faster when operated on. Many CT scans will cause radiation. A blood test will tell you everything about cancer. Anyone who undergoes chemotherapy will lose their hair and die early. These are not true, but are believed because they are heard from friends, neighbors, or relatives, leading to confusion, refusal to screen or treat when needed. The role of family and community. If you cannot change your perception from the inside, change it from the outside. Family children can be the ones to convey accurate information, explain gently, and encourage grandparents and parents to go for a checkup when there are unusual signs. Bringing medical knowledge to the elderly cannot stop at books and newspapers, but needs to be through pictures, videos, easy-to-understand language, and especially needs sincere concern. A simple sentence like, "Mom, go for an endoscopy so I can rest assured," can be more effective than a long medical lecture. Lack of knowledge is the most dangerous gap in the journey to protect the health of the elderly, but it is something that can be completely overcome by listening, understanding, and accompanying the family and community. The more they understand, the better chance seniors have of detecting it early and living longer. Reason 5. Cancer develops silently, causes little pain in the early stages. If there's one thing that makes cancer so dangerous that it is unpredictable, it is. It is silent, quiet, and almost painless in the early stages. And for the elderly, who are used to trivial pains every day, this silence is even easier to ignore. No pain is not equal to no disease. We often believe that a serious disease like cancer will come with obvious symptoms: severe pain, constant fatigue, rapid weight loss. But in fact, most types of early-stage cancer do not cause pain, or if they do, the pain is very mild, very vague, not enough to make the patient feel something serious. For example, early-stage liver cancer may only cause a feeling of mild bloating, flatulence, indigestion, easily mistaken for digestive disorders. Early lung cancer may be just a mild, infrequent cough that doesn't cause shortness of breath. Prostate cancer may not cause any obvious signs for months or even years. Breast cancer is sometimes just a small, painless, non-red, non-swelling lump, and is only discovered by chance when touched. That's why older people, who are used to unusual changes in their bodies, often ignore, endure, or take these signs lightly, simply thinking you're old. That's how your body is. When you feel pain, it may be too late. Something more serious is when cancer starts to cause obvious pain, usually when it has invaded or metastasized. Back pain due to bone cancer or metastasis to the spine. Severe abdominal pain due to a large liver or pancreatic tumor. Shortness of breath. Chest pain due to widespread lung cancer. Vaginal bleeding after menopause, a late sign of cervical or endometrial cancer. At this time, the prognosis for treatment will be lower, the ability to control the disease will be more difficult, and the quality of life will also be severely affected. If detected early, at the stage when there are no obvious symptoms, the treatment results can be very different. Older people often tolerate pain well, but that is not a good thing. In many older generations, tolerating pain and enduring are seen as a sign of bravery, of not bothering children and grandchildren. They consider pain to be normal, no need to complain, no need to see a doctor. But in the case of cancer, that silence can be an invisible sentence. If the pain comes from a malignant lesion, it should not be taken lightly. But many older people say, just bear with it a little bit and it will pass. It's not worth going to the hospital. Painkillers are enough. And so, they miss the golden time to intervene when the disease is still manageable. Listen to your body, even the smallest change. In old age, every change in the body carries a message. A small tumor, a strange pain, an unusual feeling of fatigue, all are worth considering. Do not wait until the pain is severe, the collapse is obvious to act, because by then, cancer may be one step ahead. Cancer is not noisy when it starts, but it is devastating when we detect it late. The silence in the early stages is the reason why many elderly people miss the opportunity for early treatment. Do not let the lack of pain fool you. With cancer, it is always better to be safe than sorry. Cancer is not the end, but late detection is very likely to be. In the elderly, cancer is not only more common, but also more likely to be overlooked. Through the 5 reasons we have just learned together, from subjectivity, fear, lack of knowledge, not having regular screening, to the scary silence of the disease itself, we see a reality. Many cancer cases can be detected early, if the elderly are cared for in time. Sometimes, being proactive does not start with the patient, but starts with the children, the community, from a small conversation, or from taking parents for regular checkups. One endoscopy, one ultrasound, one consultation can save a life. We cannot control age, but we can control how we deal with our health. For the elderly, every year of healthy living is a gift, not only for them, but for the whole family. Don't wait until the symptoms become obvious, when the pain is unbearable, or when the hope of treatment is slim. Early detection saves lives. Early care preserves happiness. Let's start today, with sincere attention, practical action, and the belief that old age can still be healthy and happy, if we are vigilant and act in time.